He's famously reliant on his old nanny. But today, Commons leader Jacob Rees-Mogg himself adopted the role of nanny to the nation in the fight against coronavirus.
Wash your hands to the national anthem.
For the Prime Minister, a different soundtrack.
2 times happy birthday, hot water and soap.
But whichever you want to sing along to, the government message is clear. Hand washing is the first line of defence against the virus, along with using hand sanitizer gel. Covering your mouth and nose with a tissue or your sleeve and not your hands when you cough or sneeze. Putting used tissues in the bin immediately. Refraining from touching your eyes, nose or mouth if your hands aren't clean. And trying to avoid close contact with people who are unwell. And if in doubt, as this viral video shows, just keep your hands to yourself.
Have you got a grip on this?
After today's meeting of the Cobra Emergency Committee, a government battle plan will be published tomorrow. The Chief Medical Officer has warned that if the epidemic worsens, sports events and concerts may be cancelled and schools closed for more than 2 months, with the country paying a heavy social cost for efforts to thwart the virus. Well, joining me now from the United States is Dr. Jonathan Quick, former chair of the Global Health Council and author of the book The End of Epidemics. And with me in the studio is Justine Roberts, founder and CEO of the online forum Mumsnet. Let's start with you, Justine Roberts. Some anecdotal evidence that people are stockpiling.
Yeah.
How worried are your members? Are people preparing, stockpiling food?
Absolutely. I mean, people, the most common question on Mumsnet actually is, how worried should I be? And then some other people are saying, am I unreasonable for not being very worried? But lots of people have been stockpiling, and we've had thousands and thousands of posts of people recommending what's the best thing to stockpile, you know, how aggressive should they be, and long lists of things. I mean, obviously, baby wipes and nappies and formula milk and stuff like that, but also alcohol, gin, medicines, pasta, everything, you know, my favourite rice cakes. So people have been doing this for many, many weeks now, and Mumsnet are notorious for being heavily prepped for any eventuality, and so they're taking this quite seriously.
Do you think they're panicking or being philosophical?
No, I think they're being incredibly practical, and that's the biggest, you know, as you'd expect from the nation's mothers.
Well, let me put your top question, how worried should we be, to Dr. Jonathan Quick now. How worried should people be?
Well, I think on the one hand, we're really concerned in that just in the last 4 weeks, we've gone from this virus being in 24 countries to over 50 countries. We've gone, if we leave China aside, from 100 cases worldwide to 7,000 with another 1,000 yesterday. We should be concerned because if we take the flu, 1 in 1,000 die. If we take the coronavirus, the current one, it's 10 to 20 in 1,000. But on the other hand, the reality is that in most countries, it's a few dozen people. And if we identify those few dozen people, and I must say that the health workers and the public health community is doing a great job, we isolate those people and we contain the virus country by country, we do have the potential of controlling it.
If this moves beyond containment, though, how aggressive do governments have to be? I mean, just to be sort of blunt about it, do they have to focus on preventing lots of deaths at the expense of the economy?
Well, you really want to do it in an area by area approach, and keep the economy moving to the extent you can. Obviously, providing specific specific recommendations for businesses, work at home, that sort of thing. The other thing is the government needs to be investing heavily and rapidly in vaccines. That's a major quiver in our, which will be a major arrow in our quiver, and so that's an important part of the government role.
Justine Roberts talked there about governments giving recommendations. Do your members feel that they're hearing enough from the government, the NHS, and is that advice consistent? Well,
I think they've heard a lot about washing your hands, but it has been noted on Mumsnet that previous epidemics in other countries have been controlled by quite extreme measures, and everyone's waiting for the extreme measures to hit here. We seem to be, you know, the least extreme in the spectrum in terms of the world's countries. So
could be
I think,
because cases haven't spread so much here as in Italy,
yeah,
for example.
it's true, but obviously it's, you know, the numbers are on the rise, and if it works and it prevents death, then I think people are prepared to take quite extreme measures.
Well, let me put those extreme measures to Dr. Jonathan Quick. Then, at what point do you think governments should decide to shut schools, end sports events, basically stop people going out?
Well, it's the point at which you have a spread that is accelerating day by day and is happening in multiple places. There's no particular magic number. What we look at is the trend. And so what we're seeing in at least one of the countries outside of China that's taken off, in Singapore, we're seeing that they have managed with initially some very tough measures to begin to bring it back. So what the government's going to do is it's going to look at the number of new cases each day, and if that's accelerating, then the measures will be more extreme. We know from the most similar thing, or a similar thing, the Spanish flu 100 years ago, that those cities that moved quicker to put in place multiple controls, school closures and all, and to keep them in place, had a much lower fatality rate. So those measures are critical. And it's also important to keep in mind that at this point, with a few dozen cases, it should be business as usual for most things.
Okay.
The other important point is to look at who is killed, who dies. It's the older people. It's a 10% fatality rate there. So also thinking about vaccination for pneumonia and those sort of prevention measures.
Jonathan Quick, Justine Roberts, thank you very much.